this is an article that came out of our department about patient satisfaction with access to 2 interprofessional academic family medicine clinics, and the link will take you right to the journal article. And this is a local Ontario academic practice. So if people wanted to know, oh, you know, this is, you guys, you're so ivory tower, you never really give us the local stuff, it's not the same in Ontario. We have also tried to show them the research that's been done in Ontario that applies to them.
It doesn't mean that it's available from that Dutch study. I know that Dutch study, available from the Groot and the Haan.
Oh, this Dutch study? So this one here.
Oh, that's another, okay, don't forget
is another article on the organization of telephone services and patients' access to doctors. This would be a Dutch study that was done and gives some example of some international context. So we have a local context and an international context for them to look at, to see what's applicable to their particular practices. I'm just going to keep going here. This one is on epilepsy, and I use the epilepsy indicator because it's not the sexy chronic disease diabetes indicator, but we all use it in practice, and none of us are ever up to date and familiar with all the anti-epileptic drugs we should be using. We don't know necessarily when we last checked the drugs of our patient who have epilepsy. We're not sure whether we've connected our patients up with all the resources that could help them. All of those kinds of things are classical in this situation. So here, the standard of practice is that you would be familiar with best practice guidelines and that you would have reviewed them and gone over them, and we will have them here in our resources. So Epilepsy Ontario will give them the best practice guidelines. They can go right there to have a look at it. And the Stanford School of Medicine gives them the self-management, self-practice guideline on how to deal with it. So when they come into Epilepsy Ontario, there will be a resource center. I'm not going to go there right now. And in the resource center are the latest guidelines for epilepsy for Ontario. And the reason we've gone to Epilepsy Ontario is we've reviewed all of the guidelines that our medical association puts together, and there was nothing about epilepsy in them. And so then we looked at the Cochrane review, and we really felt that the Epilepsy Ontario guidelines would be the ones that appealed most to the family physicians, and that's why we put it there. Doesn't stop them from looking at anything else and deciding that isn't the one they want to go with, or if there's a new article that we're not aware of, they can use. But there will be a resource for them to use which will help them with that problem. And then here, the Ross article here, which comes out of the NCBI, a systematic review of the literature and management of newly diagnosed patients with epilepsy, is another one.
Is there any clue about how often patients or doctors use that? Because in rural areas they may need it very much, but in Holland it's fairly rare that doctors will in depth
our pilot projects, they never went to it once.
Okay, that's the question now.
So, but we think with time the younger doctors will start using it.
Probably a little more, yeah.
So I just wanted to talk a little bit, we talked a little bit about the open access of our book. One of the things we wanted to do is to make sure that the price wasn't something that limited people accessing the book. And also because it was originally funded out of public funds, we really didn't feel that there should be any profit motive in producing this book, which was a very important part of the development of this book. Also, there was a lot of people wanting to take credit for the book because they'd been part of something associated with the book. So we have developed a series of tools which we have felt, I'm just going to,
your presentation, is it all, also on the website?
Not yet, not this present, but it will be. So this is our HTML version. We're going to be launching our website very soon. And in our HTML version, try and make it a little bigger here, each of our sections will be openable, and you'll be able to get into each of the various indicators. You'll be able to log in, and under our copyright, you can use the book for your own purposes multiple times, but you can't use the book for a program without permission to use it for a program. So our membership login is that you would get at the moment it's not there, you can just download the book, but with our plan is that you'll log in, and every time you use it, you use the same login. So we'll be able to determine how many downloads are actually happening, which are actual downloads of the book. We had 2,400 downloads in the last 3 weeks. So we know there are a lot of people using it, but it may be the same person using it over and over again rather than many people using it.
You get it with the same computer?
We don't really care whether they're using the same computer or not. We just want...
Just if you want to check if it's someone who maybe to use it for...
We will give everyone a login number, so regardless of what computer you're at, you can use that login number, your password to get in. And then we have a copyright section. I just wanted to show you that over here. So this is our copyright. Individuals may download and use the material for family practice quality improvement on an individual basis. You can't photocopy it, circulate it, any of those kinds of things. And it is officially copyrighted, and it's been copyrighted using open access. I forget what that's called. There's an official open access copyright, and we have the highest level of copyright, which means that you have to get permission to copy it and circulate it. Now, of course, we'll give permission. We just want to know who's using it and that they're using it with the right intentions in those situations. So that's the purpose behind that. And the idea would be that we would have this HTML version on our website. We would have the PDF version on our website. We also have a really neat digital version here, which takes you from page to page and can take you to the various categories. And I have to tell you that this is the coolest thing. And it costs nothing.
It's really good.
It really costs nothing. When you're doing it, you have very little money. You get someone who designed, this woman who designed it for us said, "Oh, I've never used one of these tools. I'll do it. I'll learn how to use the tool and I'll do it for you for free." You know, and it's really great. So you can go to any page and you'll be able to turn the pages, and this will be free as well on our website, the digital version. But the idea is that you won't be able to download the digital version. You can just use the digital version.
So when I downloaded your book 2 days ago and sent it to the EQuiP group of tools and methods, I was violating the copyright that I didn't really know anything about.
The copyright was right there on the front page when you downloaded it, but you didn't read it. And it's not unusual for that to happen. Yeah, you probably were. You should have probably sent the link and asked them to download it. But if you'd have asked me, I'd have said fine.
Yes, but the problem is that this is like all the things you have to go through and tick a box at the end, and you never have time to read it anyway, and you don't really understand what it's all
So
about.
on an individual basis, this isn't a problem at all. It's when a government chooses to use it, they'll check the copyright and they'll make sure that they have got permission to use it for that particular purpose. It doesn't bother us on an individual basis. The other idea here is that we're going to have an app for a phone, and people will be able to have, in fact, this version works beautifully already on the phone, and whether it's an Android or a BlackBerry or an iPhone, you'll be able to use it. Again, the guy who's making our website said, extra $200, I'll do that for you as well. So it's really, these things are not very difficult to do once you kind of get into them, and they're really cool. And so, so this is my daughter graduating from law school. I have 2 children. My son is a family doctor and my daughter is a lawyer. I don't know whether that means that I was a good mother.
You still want to prove it, right?
You know, is this a process or outcome indicator?
Both.
Well, you need some context. You need to know that your husband is a lawyer.
Yeah, he's a lawyer.
To put that into. Yeah.
Is that a good thing or a bad thing?
I don't know.
There are also some order forms here that I have, if anyone wants them. The other thing is that the book is available through McMaster Titles Bookstore, which is an espresso bookstore, which means it's a one at a time printing. So when you order it, it takes you a few weeks before you get it, because they only print one at a time. They don't have them in the bookstore. But we have now, through open source, using an organization called Lightning Source, got it listed through Amazon, Barnes & Noble's, Chapters, Indigo. That's right up this week, so people will be able to order it that way as well. Again, not to underplay the value of the electronic version for all of the links, but knowing that nobody actually uses the links. The book is available for those people who like to have all of the indicators close by and who like the smell of books and who like to find by moving through the pages easily what they're actually looking for. But the content is exactly the same as what we have on the website. And I just put this in. I thought this was a good way to finish here. The myth of the hero innovator. The idea that you produce by training a knight in shining armor who loins girded with new techniques and beliefs will assault the organizational fortress and institute changes in himself and others at a stroke. The fact of the matter is that organizations will, like dragons, eat the hero innovator for breakfast.
So you went to breakfast or the Canadian. Well,
So it's made out of edible paper. It's all a long journey. It's not a simple matter. It's not one solution. It's not one breakthrough.
you'll see a lot of development still.
Yeah.
I'm curious whether EQuiP will manage to have a sort of a accreditation group which discusses all these various methods and sees what is the best of it and how do you can further develop a method that's that is applicable and fundable and well cost effective and relevant and clinically effective. You see, and it's I think we're at the beginning of a long process.
Yeah.